I was, making all these big plans, go to Bellingham, starting on this whole new path, and I passed out. No, I had never passed out before, so I'm just like, wrote it off as stress. A big change in my life is about to occur. I'm just gonna hope that it doesn't happen again. 1 week into living in the dorms, I actually passed out again, and I was up, and then I was down. After that second time, I had to call my parents and say, look, I've been passing out, and I don't know what's going on. And I mean, it was scary. I was terrified. I didn't know, I couldn't do the things I wanted to do. I couldn't drive, couldn't play soccer because I didn't know if I was gonna pass out on the field. It was hard.
Most of us around here, one way or another, are gonna likely be affected either personally or someone in our family with heart and vascular disease. And it strikes too often in an unexpected way. And when that happens to you or your family member, you're gonna want care, and you're gonna want care as soon as you can get it in the best and highest level that you can achieve. Every day, we are trying to make that a reality.
We've managed to put together a system of care and a collection of providers that really can elevate the level of care for this community beyond what you would expect.
We provide everything short of transplant in pediatrics right here at St. Joe's. So our patients don't have to leave the community, they can stay here. And that's always been a really important factor for us in what we do. We want to keep our patients close here in the community so their families can be with them when they're going through these surgeries and these complex procedures. That's really the key piece, and the more we can keep that technology here and keep those excellent physicians here, it's just a complete benefit to the community.
Medicine today is really challenging. Unfortunately, the support for hospital services and insurance payments just don't meet the needs of what hospitals need to do to be able to provide the most cutting-edge level of medicine. And that's where the PeaceHealth Foundation fills that gap.
We're extremely lucky to have that foundation. It really does make a difference. Not just it saves lives, but it actually helps us take care of patients who otherwise would not be able to receive care.
Read my readings of what my heart was doing, and he said, your heart stopped for a good amount of time, and you're not leaving here without a pacemaker. That was the scariest thing I've ever heard. But Dr. McGregor, all the nurses were incredibly supportive. They made sure I wasn't afraid and that I knew I was in good hands at all times.
It's a really special thing that a patient will allow us to make an incision on their body and trust us to do that and do it well. We are really grateful for the foundation and the efforts the foundation is making to improve the quality of imaging at PeaceHealth.
We've always had advanced equipment here, but like anything that's computer-based, it tends to lag behind, and we were lagging behind.
Staying current with that technology as it evolves generally means shorter procedure times, higher success rates, lower complication rates. The advent of three-dimensional mapping systems that allow us to make detailed maps of people's hearts that we can look at in real time, this has really revolutionized what we're able to do. Now we've got the opportunity to take a lot of people with really sometimes disabling episodes of arrhythmia and completely eliminate those arrhythmias. And there's few things in life more gratifying than having one of those patients come back and tell me, I can't even believe this. I feel like a new person.
He said I was gonna be coming out of that surgery better than I was ever before, and they weren't wrong. I kind of have a little thing for hearts now. There's little hearts everywhere, all over my apartment, and it's just like a reminder that my heart's still beating, I'm still going. I'm thankful, I'm really thankful, yeah.
I mean, that's what it's all about, right? That's what we're trying to accomplish for people. I give because I want to make sure that I support that level of clinical excellence community-wide.
That really is the heart of what we're doing, to branch out and to reach into the community, to those that have an opportunity to be generous with time, talent, and treasure, and to lift up those that are in a serious physical need.